Hey, it's Trey Jones, and we're going to jump right in here to our Medicare Basics video. Medicare is our country's health insurance program designed to cover mainly people who are at least age 65. Now, Medicare is a federal program, but it's administered on the state level by Social Security. So if you are already set to draw Social Security by age 65, then you should automatically be enrolled in Medicare, should not have to do anything. Now, in this case, you should receive your Medicare card 3 months before the month you turn 65. Now, having said that, if you are automatically enrolled, it's always a good idea to contact Social Security just to verify your enrollment. If you are not set to draw Social Security at 65, then you may have to enroll yourself, which is very easy to do. To enroll yourself in Medicare, contact Social Security. You can call them on the phone, go online, or walk into a local office and fill out the applications. In this case, you should receive your Medicare card inside of 60 days from the day you fill the applications out. Now, I can tell you from experience with my own personal clients that about the same time you're looking for your Medicare card, it is very likely that you'll also be receiving a steady stream of junk mail, direct mail marketing from insurance companies. So I'm going to tell you what you're looking for. Your Medicare card is going to come to you from the Department of Health and Human Services. So the most legible part of the return address is going to say Department of Health and Human Services, and then underneath that, in smaller font, it'll say the Centers for Medicare and Medicaid Services. This is what your Medicare card is going to look like. It'll be red, white, and blue, have your full name on it, and it'll have 3 important pieces of information that any doctor, clinic, any provider would need to bill Medicare on your behalf. First, it's going to have your Medicare claim ID number, which will probably just be your Social Security number followed by a letter. And then it'll have your effective dates for Parts A and B of Medicare. Now, there are actually 4 parts of Medicare, but Part A, which is called your hospital insurance, your hospital coverage, and Part B, which is your medical coverage, are the only 2 parts of Medicare entirely managed and provided to you by the federal government. These are often referred to as original Medicare. Everything else I'm about to list up here on the screen is a private insurance product. It's going to be marketed and sold to you by private insurance companies. So we've got Part C, which is the Medicare Advantage program. Part D of Medicare is going to set a standard for your prescription drug coverage. And then in addition to the 4 parts of Medicare, we have the Medicare Supplement program. So this is everything that you have at your disposal. These are all available components in Medicare. And there are 3 basic ways that you can combine these. Option 1, original Medicare, which we now know is going to be Parts A and B of Medicare, plus a drug plan. Original Medicare plus a drug plan. Now, I'll tell you that most people are not going to use option 1 just because it is very basic. If all you have is original Medicare and a drug plan, then you can be left exposed to relatively high out-of-pocket cost, especially if you get to a point where you're having to use your health care frequently. So that's option 1. Option 2 is to rely solely on a Medicare Advantage plan. And I can tell you that most of these plans are going to roll in coverage for your prescription drugs. Option 3, last but certainly not least, original Medicare, just Parts A and B, plus a drug plan, plus a Medicare Supplement plan. That's option 3. So those are the 3 ways that you can combine all the different components of Medicare for your own use, for your own coverage. What we're going to do now is go back and look at each individual component, and we're going to start with original Medicare, the first half of which is Part A. It's your hospital coverage. Now, for most of you, Part A is not going to require you to pay a monthly premium. The rule says that if you or a spouse worked 40 quarters, which is 10 years, and you pay the appropriate taxes during that time, then you're going to qualify for premium-free Part A. Now, Part A Medicare is going to carry a deductible. It's $1,316 per benefit period. And it's important that you notice this is not an annual deductible. So you could be asked to pay this deductible several times throughout the course of a year. All right, it's per benefit period. A benefit period for Part A starts the first night you spend in a hospital where you have formally been given inpatient status by your doctor and the hospital's billing staff. You're not just there for observation. Okay, and it doesn't end until you've been discharged from the hospital and home, out of the hospital for 60 full days. So that's a benefit period for Part A. All right, so paying that deductible, paying the $1,316 is going to cover you for 60 days. It's going to cover Part A services for 60 days in a hospital. That's days 1 through 60. If your hospital stay lasts longer than 60 days, on day 61, your share of the cost is going to go to $329 per day. Now, I hope that nobody that's watching this video ever experiences a hospital stay that's longer than 90 days. But if you do, on day 91, then your share of the cost is going to go to $658 per day. And these are called your lifetime reserve days. You only get 60 of these. Some of the things that Part A is going to cover are going to be meals, a semi-private room, general nursing care, and any miscellaneous drugs or supplies that you would need for your treatment as an inpatient in a hospital. Under certain circumstances, Part A of Medicare will also cover brief stays in a skilled nursing facility for convalescence, for rehab. As long as you have a qualifying hospital stay, which is 3 days where you're treated as an inpatient, and then within 30 days of leaving the hospital, you check into a Medicare certified skilled nursing facility, then your share of the cost for days 1 through 20 is going to be $0. The most common application of this benefit that I see with my own clients is for joint replacements, knee replacements. So if you have a knee replaced or a joint replaced, it seems like the magic number is 2 weeks. You leave the hospital and then you go into a skilled nursing facility and immediately start doing rehab, and most of those folks are there for right around 2 weeks. If for some reason you're there longer than 20 days, on day 21, your share of the cost is going to go to $164.50 per day. That's for days 21 through 100. And this is important. It's important that you understand that Medicare doesn't cover any long-term care. So if you're in the skilled nursing facility for longer than 100 days, then on day 101, you're responsible for everything, all costs. All right, so that's Part A. Part B of Medicare is your medical insurance. Now, unlike Part A, Part B is going to require you to pay a monthly premium. And in 2017, it's $134 per month. It's commonly taken directly out of your Social Security retirement check. If you're not drawing Social Security by the time you turn 65 or by the time you enroll in Part B of Medicare, you can set that up to come out of your checking account or pay with a credit card or whatever you want to do. And you would just contact Social Security to set up an alternate means of paying that. This is also controlled to some degree by your income. And I do want to say that no agent, no broker, including me, can tell you how much you're going to pay per month for Part B in Medicare. Only Social Security can do that. And you can contact them. Their number is 1-800-772-1213. That's the main number for the Social Security Administration. Okay? So Part B of Medicare is going to have a premium. It's also going to have a deductible, and it is an annual deductible. It's only $183 per year. So you're going to pay the first $183 for any Part B covered services, and then Part B of Medicare is going to pick up its share of the cost, which is 80%, leaving you to pay 20% for any Part B services for the remainder of the year. Some of the things that Part B of Medicare is going to cover are going to be doctor's appointments, doctor services, outpatient procedures, preventative treatment, durable medical equipment. Durable medical equipment would be like walkers or wheelchairs or oxygen equipment like a CPAP mask. Also going to cover ambulance services and emergency room visits that do not result in an inpatient stay in a hospital. So if you go to the emergency room and then you have to check into a hospital where you'd be treated as an inpatient, then Part A would cover that emergency room visit. The last thing that I want to make sure you understand, actually, you know what? Let's go back here for a second. The very first line on this slide says doctor's appointments / services. So Part B of Medicare is going to cover your doctor services. This is an important point. A lot of people think that paying the deductible for Part A, which is $1,316 per benefit period, is going to cover you completely for 60 days in a hospital. They think that you would have no other out-of-pocket costs. That's usually not true, because presumably while you're an inpatient in a hospital, you are going to receive treatment from a doctor whose services can be billed to Part B of Medicare, in which case you would pay the deductible for Part B, which is $183, and then 20% for that doctor's services. So just paying that Part A deductible does not necessarily mean that you're going to have absolutely no other out-of-pocket costs for 60 days in a hospital. That's an important little nuance there. All right, the last thing I want to make sure that you understand about Part B of Medicare is that when you enroll, your timing is important for a couple reasons. First, a lot of my clients don't retire at 65. They continue to work, and they continue to be covered by their employer's group plan. In this situation, in this case, if you're going to work past 65, past your Medicare eligibility, make it a point to sit down. Make it a priority to sit down and have a conversation with your employer's benefit administrator so that you know exactly how Medicare is going to work with your employer's group plan. Generally, if your employer has 20 or more employees, then the coverage of that employer is going to be primary to Medicare. It's going to pay before Medicare would, which can leave little or nothing for Medicare to cover. This is why a lot of people in this situation choose to defer Part B of Medicare, not to enroll in Part B until after they're retired and no longer have access to their employer's group plan, at which point the federal Medicare program would give you an 8-month special enrollment period expressly for the purpose of enrolling in Part B of Medicare. And that 8-month special enrollment period is going to start the first day of the month after your employer's coverage ends. Okay. Now, what you don't want to do is defer Part B of Medicare just because you don't want to pay the premium or for whatever reason if you have no other coverage. This is where people get hung up with the late enrollment penalty for Part B. Part B of Medicare carries a late enrollment penalty. It's up to 10% of whatever your Part B premium would have been for every full 12 months that you could have had Part B, but you didn't, and you had no other credible coverage like employer coverage. So you don't want to get hung up with that. Also, turning 65 and enrolling in Part B of Medicare for the first time triggers the beginning of a 6-month window that you get once in your life. One time you get this 6-month window. And this is called your open enrollment for Medicare Supplement, or Medigap. Okay? Now, inside of that 6-month window, you're given special rights and privileges to buy a Medicare Supplement plan. Very, very important. I'm going to leave you hanging on that just for a few minutes, but in the next video, when we go through the Medicare Supplement program together, I'll refer back to this and explain to you exactly what those rights and privileges are and why they're so important. So, if you have any questions about anything I said in this video, or you just need some help, feel free to reach out to me. My office number is 1-800-520-5560. I hope you enjoyed this video, and I will see you in the next video. Thanks. Bye-bye.